Good morning, everybody. I am Laura Colbert. I am the Executive Director at Georgians for a Healthy Future. I am so excited to be here with you all this morning. Just really pleased to be here on this bright, sunny morning, at least in Georgia. Um, some of you may be new to Georgians for a Healthy Future, and some of you will know us really well. And those of you who know us really well may be wondering a little bit why we're hosting an event about housing and why we've spent a year really researching the housing needs and policy solutions for Georgians with developmental disabilities. Um, as an organization that has spent much of our first 15 years focused on issues related to health coverage and health care, this might seem like a bit of a departure, but at GHF we know this as well within our mission and vision. We have long recognized that the health and well-being of Georgians is heavily influenced by what happens outside of their health insurance and outside of the doctor's office. In some ways, more influential, those outside factors rather than the more clinical factors. Way back in 2015 and 16, GHF mapped out a health and all policies approach that we knew would be fundamental if we wanted to achieve our aim to build a state where it's easy for people to live their healthiest lives and thrive. Um, and one of the most important components of that health and all policies approach was housing, is housing. There is incredibly strong evidence that housing has a major impact on our physical and our mental health. And when housing is inadequate, thinking things like mold or housing is unstable because of family dynamics or unaffordable rent, it can worsen a person's health, drive up their healthcare costs. So it has both a direct impact in their bodies as well as potentially economic impacts. On the opposite side, though, when people have stable, affordable housing that is free of health hazards, that can serve as a protective mechanism, kind of like a vaccine that helps keep people healthy, helps boost their health as they maybe navigate other health challenges. And this is particularly true for people with people with disabilities, including developmental disabilities, children, and other folks with high health needs. So for those reasons, we firmly believe that housing advocacy is within our mission to collaborate with communities and partners to create policy change that promotes health equity here in Georgia. And even more than that, not only is it within our mission, but it's an imperative. So here at GHF, we are very excited for this kind of public kickoff of our housing advocacy work. And we will continue to focus on this issue, especially around Georgians who experience some of the biggest health burdens and the biggest health disparities, often because of systemic discrimination or disinvestment. So we're really thinking about rural Georgians, Georgians with disabilities, communities of color, and low-income folks in Georgia, a lot of those same groups that we're thinking about with other healthcare issues. Thank you so much for being here this morning as we kind of find our way and dip our toes into this policy area. Even though we are new in this space, we have some very exciting research and recommendations to talk about. So I'm really looking forward to it. I hope you are as well. And I think you'll hear and learn a lot from our guests this morning. So thank you. In addition to welcoming you, I have the great privilege of introducing Darcy Robb. Darcy is the Executive Director of the Georgia Council on Developmental Disabilities. She brings incredible experience to GCDD after having served in roles at Employment First Georgia, the Georgia Vocational Rehab Agency, and the Families First program at the Georgia Division of Family and Children's Services. Darcy has a bachelor's degree from Williams College and a master's in public administration from the University of Kentucky. And as I prepared my notes yesterday, I learned that she is a competitive ice skater in her spare time. So please give a warm welcome to Darcy Robb this morning. Darcy, thank you so much for being here with us and for GCDD's partnership on this effort.
No, of course. Thank you for that wonderful introduction, Laura, and thank you so much for hosting this event. I am so excited to be part of this and for us to talk about housing today, because this is an issue that really needs more attention. in Georgia for all populations, but we really need it for Georgians with developmental disabilities. So at GCDD, we are a mission-driven organization. Our mission, for folks who may not be familiar with it, is that we are about making the kind of social, or bringing about, I should say, social and policy changes for people with developmental disabilities and their families to live, learn, work, play, and worship in Georgia. So a really broad mission, but that's because ultimately at our core, we are about inclusion and community life, and for people with developmental disabilities to have agency and inclusion and choice. And so our interest in something like housing is not in how would we do something separate that's intended just for people with disabilities, or how would we separate people with developmental disabilities. We're really about how do we build a community that is going to support and accommodate everyone? You know, how do we support people with developmental disabilities to have their own homes? And I will tell you all that of all of the issues, I think housing is the one for our community that nags at me the most, because we really don't have a whole lot of models or of support for people with developmental disabilities living in their own homes. There tends to be a big reliance on folks with developmental disabilities remaining in family homes or going to a group home. We need to move away from the model. And so I'm really excited to be part of this conversation. The primary ways we do our work at GCDD are through system change, advocacy, and capacity building. And I would argue that right now we need system change, advocacy, and capacity building around housing. The last thing I'll mention is that something that I consider a real privilege of working at GCDD and of the work we do a lot of advocacy. We also fund a lot of projects. This partnership with Georgians for a Healthy Future is one of our projects. But we are governed by a council of people with developmental disabilities, family members, and partnering agencies. So I think that's really important, that those are the folks who ultimately govern our decisions and our work. And I see a couple of my council members on this call today, so thank you all for being here. But with that, I am just as eager as everyone else to get this kickoff really started. And so I will pass it back over to Whitney, I believe, to go ahead and dive into what you all have found.
Great. Thank you so much, Darcy. And thank you, Laura, for giving us that context. My name is Whitney Griggs, and I am the Senior Policy Manager with Georgians for a Healthy Future. And I am excited to be able to share both the results of our research project with you all today, along with the policy recommendations that we've made based on the data that we received. So a little bit of an overview of how today is going to go. I am going to go ahead and dive into our results and policy recommendations. We'll do a little bit of a Q&A afterwards, so you all can ask anything that you'd like about the policy recommendations or the survey findings themselves. And then we'll go into a panel discussion. We have some national and local experts joining us today that we're very fortunate to have. So we'll ask them a few questions and then have another Q&A with them and then wrap up. So hopefully this feels like a very interactive opportunity. You can put your questions in the chat and we'll try to get to as many of them as possible. So without further ado, let's jump in and start looking at these results. So a few disclaimers to get us started before we get into the meat of this. As we've discussed, support for this project was provided by the Georgia Council on Developmental Disabilities, and the views expressed here in the report and in this presentation do not necessarily reflect the views of the council. None of the recommendations in this report are endorsements of specific housing settings or housing types. We have been very deliberate to use as broad of language as possible. If you hear me say something today that doesn't quite line up with that, it is a mistake on my part. And one of the biggest learnings for me throughout all of this has been that language really matters and what you say has an impact. So I'm still learning that piece. And in a similar vein, as Laura mentioned, this project really served as a launch of our Housing is Health initiative. And we are so excited to learn more and delve deeper into this work. Essentially, we are not experts in housing yet, and we're definitely not experts in the world of IDD, but we have learned a lot and we're excited to continue on this work. And I've seen the registrations come in. I know that we do have a lot of experts on this call. So if you see something, hear something that doesn't quite line up with what you know, welcome you to make those suggestions and share your knowledge with us. So just wanted to get those out of the way before we get started. So for the presentation today, we'll do a little bit of background, really setting kind of what is the issue as it pertains to housing, especially for Georgians with disabilities and IDD specifically, an overview of the project, how we did our research, survey results and focus group results, our policy recommendations, and then we'll jump into a Q&A. So a little bit of background on the issue of housing for Georgians with intellectual and developmental disabilities. If you have operated at all in the world of mental disabilities, whether it's IDD or serious and persistent mental illness, you are very familiar, probably you've at least heard of the Olmstead decision. And that is a landmark Supreme Court case that actually is based on someone from Georgia that established that people with mental disabilities have the right to live in a community rather than an institution. And it really marked the beginning of the end for the practice of institutionalization, which prior to the Olmstead decision, people with serious mental illness and intellectual and developmental disabilities were wholesale institutionalized in state mental hospitals. And the Supreme Court case said that people with disabilities needed to be in the most integrated setting possible that was appropriate to their needs. So there is a legal requirement that people with IDD and other mental disabilities be housed in as close to their community setting as they can be. We also know that a lack of access to affordable, accessible, and sustainable community housing is associated with an increased risk of institutionalization, homelessness, and poor health and social outcomes among people with IDD. People with IDD, family members, advocates, and providers report structural, institutional, and interpersonal barriers to community integrated housing, but there is limited data describing these experiences and their prevalence/severity of such barriers. And then state-specific data is uncommon, and it's not just uncommon in Georgia, it's uncommon nationally. And when that data does exist, it rarely examines the housing needs and challenges among people with IDD across personal identity, so across race, ethnicity, age, gender. And it's very rarely from the perspective of those with lived experiences. People with IDD are not often included in the research to better understand their needs. Oftentimes it's caregivers or social service agencies that are surveyed. So bringing that lived experience to the project was really important. So the first step in our project was forming a leadership group. And the leadership group was oversaw really every aspect of this project. It was made up of people with intellectual and developmental disabilities, as well as caregivers. And the purpose of the leadership group was to, one, bring their perspective into everything, ensure that our research was as inclusive as possible and as accessible as possible. They gave us feedback on all of the survey questions, how to get the surveys out in an accessible manner. They helped us disseminate the survey, which was a huge, huge help. And you'll see in a second kind of the fruits of those efforts. They also linked us up to key informants, helped with the environmental scan, and we're really just, without this group and their dedication, we could have not done this project. So a huge thank you to the leadership group for all of their efforts. We really appreciate it. So once we had the leadership group in place, we conducted an online survey. The online survey consisted of two surveys. one for people with intellectual and developmental disabilities that was either taken directly by someone with IDD or taken by a proxy for someone with IDD. So someone who was perhaps sitting with the person or knew of that person's housing preferences, and then an additional one for caregivers to better understand their needs and challenges. Following the surveys, we conducted focus groups that were made up of survey participants, and focus groups were really intended to give more context and depth to the survey findings and help us better understand the information that we were seeing. We then did key informant interviews to gain insight from state and national experts on housing and IDD. These experts were housing experts or IDD experts, or they filled both roles. So they were particularly housing experts for IDD. A number of those key informants are on the call today, either participating as a speaker or as an attendee today. And just a huge, huge thank you to all of them for taking the time and lending your insight to the project. And a lot of them also just helped with my own personal edification of the issue. So thank you so much for that. And then the final step was an environmental policy scan, which was a deep dive into the existing policies and practices from other states that perhaps Georgia could adapt for our own needs, as well as understanding the policies that exist in the state that are either hindering or helping Georgians with disabilities, including IDD, access housing. So from all of these data sources and all of the project, we have made 7 policy recommendations, which we will touch on today. But once I'm done with the presentation, I will link the report in the chat so you all can see it. And I really encourage you all to read the report and take a deep dive on our policy issues, policy recommendations, because we won't go into a ton of depth on them today. So the results, let's get to the good part, what everybody's waiting to hear. So the first part of the results, we had over 1,600 survey respondents participate. Our goal was around, I think, 200 or 250. So we had a huge response. And that is due in large part to all of the partners and the leadership group members sending out the survey. Without those efforts, we wouldn't have gotten all of these folks. We had over 1,200 individuals with IDD take the survey and over 460 caregivers take the survey. We asked about gender identity, and over half of our respondents were men, 40% were women, 6% were identified as transgender, and 2% identified as non-binary or other. For race and ethnicity, over half identified as white, 20% identified as Black or African American, and then some smaller percentages of other ethnicities as well. And I think what's interesting about this demographic data is that it's obviously not reflective of the demographics of the state. I am happy with the diversity that we got, but that could be another opportunity for research, is to have the demographics more reflective of the state. We did have a pretty young sample with the individuals with IDD. 63% of the respondents were under the age of 35. And then unsurprisingly, 96% of the respondents with IDD reported that they received some type of government benefit, with Medicaid coverage and Social Security disability income being the most reported. And again, if this world is familiar to you, that's not a surprising finding. So we asked respondents with IDD about their current housing status. 70% reported that they lived in some sort of a community-based setting, whether that's an apartment or a condo, a single-family house or townhouse, or a multi-family home/duplex. 55% reported that they lived with family, 19% lived alone, and 24% lived with non-related roommates. And I really want to call out this next data point, that 4% reported that they were experiencing homelessness. This number is over twice the rate of homelessness in the general population. In Georgia, the rate of homelessness is about 1.7%, and we have 4% here. So another opportunity for future research is to understand if that's really reflective of the IDD community in Georgia, or if there's something specific about the population that we reached through this project. And then 39% reported moving 2 to 3 times in the past 5 years. And reasons for moving included a lack of physical accessibility of the house, a lack of reliable and accessible transportation, and the cost of rent. We asked about housing accessibility. So we were really interested to know, how does your house allow you to move around as you desire, whether that's within the house or come and go as you'd like to, without any major hindrances. 20%, so about a fifth, felt that their home met all of their needs, which is great. They didn't feel like it was lacking. 27% felt that their home did not meet any of their needs. So that's concerning, that over a quarter felt that their living situation did not meet any of their accessibility needs. And then over half felt that their home met some of their needs. That could just be, maybe there were some minor things about accessibility that their home didn't meet, or there could have been some major issues and barriers to their accessibility. And we just don't know the answer to how much of an accessibility burden they had. 56% reported that it was somewhat challenging to find a home in their community that fit their needs. And again, if you're someone with IDD, a caregiver, if you're someone who works in this world, that's probably not a surprising result. We also wanted to ask about housing preferences and choices to understand kind of how does their current housing line up with the housing or community that they would prefer to live in. So the most important community characteristic and housing characteristic was that it's safe and secure. That's probably the number one housing characteristic for all of us, no matter what, is that your house is safe and secure. Respondents with IDD wanted to be close to family. Again, not surprising. It must be affordable, just like for all of us. We all need housing that we can afford. They wanted it to be close to shopping, places of worship, and their doctors. And then also be close to work, school, or day services. So again, very standard things that anyone without a disability or IDD would also want from their housing. When asked about the physical characteristics of their home, they said things like being in good condition, having their own bathroom or bedroom, being physically accessible, having their own place, or being in a walkable or accessible area was important to them. And then when we asked caregivers about their caregiving arrangement, and so we asked about caregiving arrangement to kind of understand, who are caregivers? Are they caregiving on their own? Are they caregiving with some support? What does their current status look like? 70% reported that they share their caregiving responsibilities with another person. And so that other person could have been another parent, a paid direct service provider, a sibling, or a grandparent. And 30% said that they were caring for the person on their own. So that could be a really heavy burden for a caregiver if the person they're caring for has a lot of needs, requires, 10 to 12 or even 24 hours of support a day. So that's something to consider when we think about the strain that caregivers are under. And then 86% of the caregiver respondents reported that the person that they care for currently lives in their home. We asked about transitioning their family member with IDD to a new living situation, acknowledging that if a family member with IDD is currently living with them, this is probably not going to be the case forever. And there is going to be a time where they need them to live in another setting outside of their home. A quarter reported that they had not considered transitioning their family member. 18% reported that they were planning to transition in a year. 29% reported that they were planning to transition in 2 to 3 years. 11% reported that they were planning to transition in 4 to 5 years, and 9% reported that they were planning to transition in 6 to 10 years. And so this data is interesting because we know that transitioning a family member with IDD into a new living situation requires a lot of work, a lot of research. It's very intensive. And so it's not something that can Ideally, it's not something that happens very quickly. It's something that you're able to put a lot of thought into. 58% of the caregivers reported that their own health or wellness needs were the main reason for needing to transition their family member to a new living situation. So when we think about the current people who are currently caregivers for a family member with IDD, oftentimes it's a child. So, these are baby boomers who are starting to think about their own health. Perhaps they have their own needs. They need to go into a different living situation for themselves. Maybe they can't afford where they're continuing to live as they get older. So that's the main reason that folks are needing to think about transitioning their family member. And we also asked about what are the barriers to transition, acknowledging that there's a lot that goes into considering when you transition your family member. So these issues included hiring a direct support professional, that there's limited support from either nonprofits or state agencies, financial reasons, so the cost of finding a new living situation for their family member. And then a lack of appropriate housing was the biggest barrier to families wanting to transition. The next part of our research, we conducted focus groups, as I mentioned, with survey respondents. The focus groups were intended to be for both people with IDD and their caregivers. But once we got into the process of recruiting for the focus groups, we found out that that a lot of the people with IDD didn't necessarily want to participate in the focus groups. So these ended up being caregiver focus groups. And so the main themes that came from the focus groups were that there is a limited housing supply and community housing options are limited, that there are limited housing resources and that these resources are difficult to locate. So focus group participants reported that they wanted to, that they couldn't find housing options, that they didn't know what was available, that it was very difficult to find. Aging parents, as I mentioned, caring for adult children with IDD reported that they struggled with finding appropriate accommodations. There's limited supports and services, and those that exist are difficult to access, or they're not affordable, or they're unavailable. And this is true even for individuals that have Medicaid waivers. The one that we probably heard about the most often is the direct service professional workforce, that finding good care is extremely difficult and can negatively impact people with disabilities. And so one, being able to pay them what they need to pay them, and then also just, having folks that are willing to do this job. And then finally, transportation was something that we heard about a lot as well. Having access to appropriate transportation is critical to living independently. So perhaps they could find an ideal living situation for their loved one or for the person that they're caregiving for, but it was not close to any transportation. So it would have been difficult for them to get to a job that they loved or for them to see their family easily. So that was a real barrier for folks as well. And then I want to wrap up the research part of this section with some quotes that we have from the qualitative findings from our surveys. And I think that these two quotes really reflect the issue and are great leeway into the policy recommendations. And the first is from a person with IDD. And they said that I have certain requirements for the infrastructure of the living environment, but I don't think it is difficult because it is a normal requirement of an adult who wants to live in a place where there are no facilities around and it's a long way from work. And then the second quote is from a caregiver, a parent. I want my child to be in a safe, supportive environment that helps him feel like he is a part of a community and is a person in his own right. I want a place that will help him thrive, not just exist until he dies. And I think those are really powerful quotes because they really get to the heart of kind of what the issue is. People with disabilities, people with IDD, they want the same housing situation, housing availability that everybody else wants. We all want to be able to live in our community in a house that we like, that is affordable. We all want to know as parents that our kids are well taken care of, that they are living the best life that they possibly can, and that they feel safe and supported. And that was really one of the main takeaways from this project, and really informed the policy recommendations that you'll see on these next slides. Is how do we support individuals with intellectual and developmental disabilities and their caregivers so they have the ability to live in housing of their choice and have all of the supports available to them to be able to do that. So now on to the policy recommendations. Again, we go into more depth on these in the report, which I'll link to when the presentation is done. But these are the recommendations that we really see as getting to the heart of addressing the issues that were raised in the survey findings. And these are presented in what we believe to be the order of feasibility. So the easiest to enact first, with the one being perhaps the most difficult or resource intensive or new, that folks really need to wrap their mind around, is coming at the end. So hopefully we can look at this as kind of here's the low-hanging fruit that we could address, and here's some more visionary things that we could do. So our first policy recommendation is to convene a standing working group that is intended to break through silos and include the perspectives of those that are most effective in order to address the housing needs of Georgians with disabilities, including IDD. And this really gets to a lot of what we were hearing in our key informant interviews and our focus groups, that navigating support services for people with disabilities, including IDD, there are a lot of silos. There are silos within the support service agencies. There are silos within the various disability communities. There are silos within the housing communities. And those silos really affect the ability to make meaningful change. So our first policy recommendation is to break through those silos and to convene a standing work group that consists of the Department of Community Health, the Department of Behavioral Health and Developmental Disabilities, the Department of Community Affairs, and the Georgia Council on Developmental Disabilities, and to also have Georgians with IDD and caregivers of people with IDD participate in that work group. Our second policy recommendation is to increase wages for direct support professionals, or DSPs. DSPs that work in provider settings are subject to the state's Medicaid reimbursement rate, which is $10.63 an hour. These jobs can be very physical and emotionally demanding jobs. They are not easy, but people have a real passion for it. But in order to make these jobs work, they also oftentimes have to work multiple jobs to make ends meet. But oftentimes it is easier, and you can get paid better to go to Walmart or Target. So to really address the housing needs, we need to pay our direct service professionals more. Our third policy recommendation is to invest in transition supports for caregivers. The state can fund transition supports for parents and caregivers to help them navigate the process, to know what's available, to find housing situations that they and their family member feel comfortable with. And we'll talk about this a little bit more in our panel discussion, but one example of this is Partners for Housing, which helps families navigate this process and find appropriate living situations, and also matches them up with roommates to create shared living situations. So this policy recommendation is really getting at support for caregivers. The fourth policy recommendation is a state appropriation for housing. And specifically, we recommend that the Department of Community Affairs set aside a percentage of the low-income housing tax credit for affordable housing for people with disabilities, including IDD. Other states have done this. Florida has set aside 5% of their LIHTC, their low-income housing tax credit, for housing for disabilities, including IDD, and this incentivizes affordable housing developers to include housing that's appropriate for people with disabilities, including IDD. The fifth recommendation is a Medicaid demonstration waiver. This is a very fancy term, but essentially these waivers are called 1115 waivers, and specifically they're called health-related social needs waivers. And they allow us to waive Medicaid rules so that Medicaid can be spent on not just health services, but on support services that ultimately impact people's health, such as housing. So other states have done this to allow their Medicaid programs to spend money on things like case management and tenant supports, which not only helps people find housing, but then stay in their housing once they have it, so they're not missing, rent payments. Our sixth policy recommendation is to provide a technical assistance program for housing stakeholders. And this is really to help affordable housing developers line up with experts in IDD housing to help them navigate the process of building inclusive housing for people with IDD. Building housing that's appropriate for people with disabilities, including IDD, is something that is new for housing developers. So it's not necessarily something that they're not interested in. It's just not something that they're very aware of. So a technical assistance program would pair developers with inclusive housing experts to know how to build IDD inclusive housing, as well as how to essentially stack funding opportunities to pay for this housing, because there are a lot of funding opportunities that can be leveraged in this realm. And then our final policy recommendation, and again, the one that is probably the most visionary, or the one that would take the most buy-in to enact, is really getting at the physical accessibility of housing. And this recommendation is to require that compliance with universal design standards. And universal design standards are standards that require that products and environments be usable by all people to the greatest extent possible without the need for special adaptation or design. So really saying that the state could say that any house that's built, or any affordable housing that's built with state funding, meet these accessibility standards. This would promote equality because housing would be accessible to everyone. You wouldn't need to go back and modify housing after the fact. So think about, wider door frames, guardrails, no kitchen islands in every house that's built, rather than specifying this just for certain housing. And this could reduce costs down the road, because instead of having to go in after the fact and make housing accessible for someone, housing is already accessible. So you would save cost on that down the road. But those are our policy recommendations. Again, once I stop sharing my screen, I will put the report in the chat, but I am going to hand it over to Kanetta now, who is going to help facilitate a Q&A.
Awesome. Thanks, Whitney. So questions from the audience about the report results and the policy recommendations. I'm going to start with a question in the chat from for you, Whitney, from Jacqueline Thornton. Jacqueline asked, are you able to stratify the survey respondents that are living with intellectual versus developmental disabilities? And if so, what was the proportion or numbers?
Yeah, that's a good question. We did not ask specifically about what type of intellectual or developmental disability that individuals have. So we aren't able to stratify that data, but I think it would be a good opportunity for another research project going forward.
Perfect. And really quickly, Whitney, I'm not sure if you have the captions, closed captioning turned on, but if you're able to enable that, I think that'd be helpful for some of the guests.
Yeah, I'm seeing the chat, and here we go. It looks like it should be on.
Okay. Perfect. And another question for you from Julie Carter. How do we get information later about the progress of this project in this endeavor?
Yeah, that's a great question. I will, sorry, I got distracted. We are really excited that we actually have funding now to be able to continue on this work and to hopefully bring these policy recommendations to life. So if you stay up to date with Georgians for a Healthy Future, you'll hopefully be able to stay up to date with the policy recommendations and progress on this project. But I am going to pause for a second because it looks like there's an issue with closed captioning. So let me see if I can fix that. Okay, I'm going to talk. They're still not appearing.
Hey, Whitney, can you look down on the meeting controls tab? There should be an option that says like CC if you press it.
Yeah, I pressed it and it says that they are on. But clearly they are not.
Okay, it looks like they might be on now.
Can you go ahead and re-enable it? Said you disabled it a while ago.
Okay. Are they? I don't see them.
So if you press the CC option again, it should turn on automatically. And then just a quick note that all users should go into the settings of their device if they're using a Mac or Windows machine, and go to the preferences and turn on the captions as well.
Sorry, you guys. I don't see the CC button now. Okay, I think we might just have to keep going ahead without the captions. But if you're able to turn them on for yourself, yeah, sorry about that, you guys. I thought we were all set to have the captions going. But yes, to reiterate, please stay in touch with GHF. I'm going to put a link to our report in the chat. And this is our website as well. So you can sign up for our emails and stay in touch with us and learn more about the progress that we're making.
Okay, do we have time for a few more questions, Whitney?
Yeah.
Okay. Another question from Diane Walush. Is there a need to look at those 35 and up as to their needs and perspective? So looks like that's the first question.
Yeah, I definitely think that there is a need to look at that population and understand kind of their do they have different needs? Because obviously that group is also, if they're still living with a family member, they're going to have an older, much older family member who may have different health needs. And that question also gets at something that we noticed in our research as well. Based on the number of people who reported living alone and the types of supports that folks needed, we can kind of deduce that the population of individuals with IDD that took the survey are fairly independent. So I think that, another opportunity for research is to really try and find folks who are maybe a little bit less independent and maybe a little bit older and understand their needs.
And the part two of Diane's question is, would you consider a provider representative in the group working on solutions, their lived experience in offering housing, and what the system can do to make provision of housing easier.
Yeah, I think absolutely. And that's one thing that we have really tried to do in this project and hope to be able to carry forward is acknowledge that there are a lot of different housing options or types available to people with intellectual and developmental disabilities. And people should have choice in where they live. And so we want to make sure that, all the perspectives, all of the stakeholders are brought in and not perpetuate the siloing going forward.
Yeah, for sure. Okay. Another question. Are you aware if DBHDD is going to do a housing survey? The suggestion is that the group be at the table as that work is being prepared and that survey is being conducted.
I did not know that DBHDD is doing a housing study. That's great to know. I don't know who asked that question, but I would love to connect and learn more about that and what questions they're asking and how we can be supportive.
And this is the last question, and that question was from Diane Willesh. So this is the last question from Diane. Do you know how many of the survey respondents had comp or now waiver supports?
Yes, we do have that data, and it is in the report. I just don't have it in front of me. So we did ask, what type of government supports do you have, and included in that was now and comp waivers. And I'm going to take a little bit of personal privilege here because I saw one more question come across about how, that some of these are some of our policy recommendations are more aspirational than others. And what do we think is the easiest to implement? And I would say creating that standing working group to really break through silos and really continue to drive the issue of housing for people with IDD, with disabilities, including IDD forward, is really important and, fairly simple to implement. And then also paying our direct service providers more. I know that the folks on the call who work with direct service providers who are provider housing, who are self-directed, they know how hard it is to hire direct service professionals, direct support professionals. And that is something the state can do. So take that little personal privilege to ask the last question. But thank you so much. Oh, it looks like captions are working. Great. Thank you so much, Kanetta, for facilitating the Q&A. I wanted to give everyone a break from listening to me chat the whole time. But I also see some questions about getting in touch. And I am putting my email into the chat as well. So please feel free to reach out and email me if you have any questions or thoughts about opportunities to improve. I really look forward to learning from all of you. And again, this is a first for us. So we're just excited to build on this. And yes, we will send out the recording of today's presentation. And I'm happy to send out slides as well when we send out the recording. But now we're going to move to our panel portion of today. And I am really excited for the panelists that we have with us. And we're going to talk about, kind of the barriers to housing for people with IDD, the supports that are available, what other states are doing that Georgia can enact, and just, hopefully hear some fresh perspectives on the issue. So I'll go ahead and do a short introduction for each person, but I'm going to let them, in their own words, tell you more about themselves. So with us, we have Desiree Kamika Galloway. Desiree is a recognized disability housing expert and founder of Neuro Inclusive Housing Solutions, which seeks to advance neuro-inclusive community development by providing subject matter expertise to industry professionals. She's also the co-author and co-editor of A Place in the World, a groundbreaking report on housing and community options for adults with autism and other neurodiversities, which I really encourage everyone to read that report. It is really informative and eye-opening. We also have Pam Blanton. Pam is the founder and CEO of Partners for Housing, which you heard me mention earlier. Partners for Housing is a mission-driven business that helps families of adults with IDD create shared living solutions that are sustainable, affordable, and serve as the foundation for a more fulfilling, good life. Her career has spanned 30 years in special needs housing, and she's acknowledged as an expert in the field. And then we also, last but not least, have David Whittington. David is the executive director of Nurture Capital Solutions, a Georgia-based nonprofit that provides nonprofits and communities with access to funding and human capital with the purpose of serving individuals with cognitive disabilities and special needs. And he is an experienced business developer and expert in addressing the wide range of needs and services for Georgians with IDD. So thank you all so much for joining us today. And I think hopefully your videos will pop up for everyone. There we go. So to get us started, Desiree, we'll start with you. I would love to hear kind of what brought you to this work and why is access to affordable, accessible housing for people with intellectual and developmental disabilities important to you?
Yeah. So about 20 years ago, I was facilitating social skills group, peer mentorship groups at the University of Miami for the Center for Autism and Related Disabilities. And I was so excited because the young men and women I was working with were going to be graduating high school. And at the time, I had no idea there was a cliff. And when the parents told me, and when the young adults told me they had no idea what they were going to do after high school, it really broke my heart. So it was about that time I started working for a not-for-profit called the Madison House Autism Foundation. We established the Autism Housing Network. I traveled around the country to try and understand what are people doing to create housing opportunities, because housing is the hub of the wheel. When we have stable housing, then other things in life can stabilize as well. And so I'm interested and work with developers across the country and do data-driven research so that we can make sure that people are not displaced from their communities, that they're not experiencing homelessness, and that they don't have to live in a home necessarily that their provider controls. And so I'm excited to be here and can't wait to share more.
Great, thanks, Desiree. And as a follow-up on that question, when you think about meaningful inclusion into the community for people with IDD, what does that look like to you?
It's relationships, right? You can geographically be in the community, but it's friendship, it's unpaid relationships. It's that natural support system. It's knowing that there are people in your life that care about you. And if you don't show up, for example, to a faith community, people are going to ask, well, where is this person? Or if you're not at, your local game night, people are going to want to know, are you okay? It's that building of natural relationships. And that doesn't happen necessarily automatically. It requires intentional work and liaison type of support to be able to do that effectively.
Great, thank you. So David, we will move along to you. Again, what brought you to this work and why is accessible, affordable housing for people with IDD important to you? Oh, you're on mute. Oh, David, you're on mute. We can't hear you.
Apologize. I was thrust into the IDD world back during the 2008-2009 recession. I was managing a company that was a financial consultant entity. We had clients inside the United States and outside of the United States. But during that period of time, there was a number of organizations and nonprofits that were struggling financially. And these organizations were just trying to navigate through the recession, but they were also part of the IDD network of service providers and people who are providing housing. And I just got enamored and thrown into the middle of this IDD chaos and thought this is where a place that really needs help. It needs help from the leaders of all industries, from banking industries, from the development industries, from service and other parts of the other what makes up a industry, to finally understand the importance and the impact that IDD has to everyone in our community. And so housing is key to everyone's life and well-being, and including the people with IDD. And I thought that is the place where I need to provide as much focus and concentration on and help with doing whatever I can in my career. So
thank you. And it's interesting looking up your bio too, because your background is business. And so it's really interesting that perspective that you bring. And so I'll ask you the same follow-up question that I asked Desiree. When you think about meaningful inclusion into the community for people with IDD, what does that look like to you?
Yeah, meaningful inclusion to me is access and choices. Each individual has their own support needs and preferences. Support services are needed, to help individuals in transportation, inconveniences, and personal management, just scheduling. There's so many aspects to each individual needs, and having those access to support services and also to housing. As we've already have discussed, housing and services or the housing and health are absolutely connected, strongly connected. And there's evidence of reports coming out of Europe and other places that also kind of uncovers the significance between those two relationships. And so access is key in choices. What is limited in Georgia is just choices. Choices in housing, choices on services, choices on job placement. I mean, the list goes on. But those two are really what I find key in the inclusion of meaningful inclusion.
Great. Thanks so much, David. I appreciate that perspective. And Pam, I will turn it over to you and let you do a brief introduction, but we also have a short video that we're going to show that explains kind of who Partners for Housing is and what y'all do.
Thank you, Whitney. So I've been working in housing and services for people with disabilities in the Seattle area for about 30 years. First 10 years, I was working in the affordable housing program in Seattle and really saw the barriers for people with IDD. And so I started moving my way over toward creating some pathways. And here we are. And I think really our video, I'm going to let it speak for me and us here at Partners for Housing.
Bear with me all.
Before we started working with Partners for Housing, I didn't feel like there were very many options. I think we thought Troy would be living at home forever.
We just didn't have the direction. Partners for Housing gave us a path forward.
Because I couldn't imagine anything worse than her having lived with us all her life, losing her parents, and then having all of that disrupted. So we really wanted her to move out while we were still alive and while we could support that transition.
When we found Partners for Housing, they immediately stepped in and kind of embraced us as a family.
Families worry about who will care for their loved one when they're no longer able, and about the costs of housing and care. They worry about loneliness and isolation, it can seem impossible to make a realistic, achievable plan for the future.
The biggest worry for a parent is that your child is going to grow up into adulthood and not have community.
Gaining access to the benefits your loved one is eligible for can be very challenging. There are so many government agencies and social service programs. It's hard for families to find the best solution.
It's a complicated system, right? And there's a lot of emotion attached to it as well. So when you're in an emotional state, you're not always at your most rational, or you don't always think clearly, and trying to figure out the systems by yourself is, you can do it, it's just really difficult and time consuming, and there's a lot of bumps along the way.
Partners for Housing helps families maximize their benefits and create housing solutions that meet the unique needs of their loved ones. The first step is to complete the residential assessment. This assessment will identify gaps in your loved one's benefits and services and help clarify your family's vision for the future.
And when we connected with Partners for Housing and started going through the residential assessment, we discovered layers of services that could be available if we knew how to tap into them.
The residential assessment includes a comprehensive review to ensure your loved one has all the benefits and services that they're eligible for, a follow-up consultation to identify the steps you can take now to prepare for the future, and assistance navigating the application process for Section 8 housing vouchers and other programs.
So Partners for Housing allowed us to know how important Section 8 was, the process of getting into Section 8. Whenever you work with federal and state and county government, it is a bureaucracy.
Thanks to a generous grant from the Dan Thompson Memorial Fund, Partners for Housing can offer free residential assessments to over 6,000 families in Washington who want to begin planning for the future. The residential assessment is an online questionnaire that you can begin today and complete at your own pace.
My first impression of the residential assessment was its absolute thoroughness. It covers so many aspects of my daughter's life. It was inspiring, it gave us courage, it gave us hope, it gave us energy to take the necessary steps to move through the process.
Partners for Housing offers additional services to help families create a shared living home. Shared living is when people with disabilities live together to share the cost of housing and services. Our roommate matching pool helps you find compatible roommates and like-minded families with similar housing goals. Our shared living development services guides families through the process of realizing their vision of a safe, supported, and resilient housing solution.
We wanted something that we could set up that would repeat itself and be able to be lasting long after we're gone.
My favorite is living with these two and the independence that's given me.
Completing a residential assessment is the first step toward identifying the resources that can make your family's unique housing goals achievable. Partners for Housing will help you with advice, recommendations, and a list of steps that you can take to prepare for the future.
Start early, and in fact, it's never too early to start.
Yeah, start the process now. My wife and I put it off for years and years and years until my wife passed away. You know, it's like they say, the best time to plant a tree is 20 years ago, and the second best time is today.
And she's grown in ways we didn't expect and in ways we did expect, and we're just really proud.
When we go out to see our boyfriends, we also see movies, and we would also go bowling.
So I live like 5 minutes away from my parents, so that's really nice actually.
We are actually more engaged with each other living apart. And now when he comes home on weekends that Beth is off, we play cards. There's much more social interaction between us and Jeremy, which is very delightful.
Go to our website for more information.
Great. Well, thank you so much, Pam, for that really informative video. And I wanted to make sure that we shared it with everyone because, you know, it does get to a lot of the issues that families and people with IDD encounter when they're trying to find housing. And I think it really takes us nicely into our next question, which is that, anecdotally, we know, and we've seen through the data from this housing project, that finding affordable, appropriate housing for people with disabilities, including IDD, is very challenging. And for some folks, it's downright impossible. Some of these challenges are challenges that happen across the board nationally. Every state kind of struggles in the same way. And then some are very specific to Georgia. So Pam and Desiree, I'd love if you could kind of just give us an overview of based on what you've done in other states and what you've seen, what are the greatest barriers, I'd say, to creating housing for people with disabilities, including IDD?
Okay, you want me to go first? I would say, bureaucracy and navigating services, the multiple silent service systems, it's a huge barrier for families. And also connecting with other families and finding compatible roommates, a huge challenge, because disability can be a very isolating experience, and finding compatible roommates and families to partner with that share vision and values can be a huge challenge. And then I would also say experienced leadership who understands how to navigate across the multiple siloed social services systems is another barrier.
Systemically, in order to meet the demand in Georgia, we need to know how many people with IDD need housing and at what time. Just this population is invisible in the affordable housing industry. When we think of when the housing industry thinks about people with disabilities, they think ADA compliance and individuals who use wheelchairs. And we know that the cognitive accessibility features that can be built into housing might not have anything to do with mobility and ADA compliance. And so being invisible as a population that needs housing is a major systemic barrier, because being invisible is tied to funding, because if you don't exist, then the funding is not going to follow you. And we know that across the country, there is a dearth of affordable housing subsidies, both to build housing as well as to subsidize rent. And when this population isn't counted as a need, that creates a much larger challenge. Just looking at the numbers that we have very conservatively, I estimated about 51,000 people with IDD are living with a caregiver over the age of 60. That's a lot of people, 51,000 in Georgia. In the whole history of HUD, there's less than 100,000 units that have been created using the disability Section 811 program. So this is a major challenge, being invisible.
Yeah, thank you, Desiree, for that. And we'll make a plug for the report too. She mentioned 811 HUD 811 housing, which is different than Section 8 housing or housing choice vouchers. And in the report, we go through all of the different housing funding mechanisms that are available to build affordable housing or to pay for affordable housing. Some of that's just affordable housing specific, some of it's specific to people with disabilities. So encourage you all, if you're want to learn more about those funding opportunities, to please look at the report. And so David, I will move to you now, and perhaps someone could teach a whole, graduate level seminar on the issues in Georgia on housing for people with disabilities and IDD. But what do you see as the greatest barriers to housing for accessible, appropriate housing for people with IDD here in the state?
Well, Pam did a wonderful job in terms of how the family and the individual kind of perceives the challenges for getting to the proper housing and the best fit housing. I look at more from a development growth perspective and how I deal with state legislation and state offices is dealing with, honestly, right now, there is no comprehensive housing plan in the state of Georgia. Now that's changing a little bit, and there were some indications of that recently on this chat, on these questions. There is a committee being formed for group home committee, being created to look at more of the issues wrapped around group homes. But to me, that's kind of myopic in terms of the total comprehensive plan that is probably needed for this. Because there's different housing types, because there are different housing needs for different individuals. So anyway, there's probably two major things. And I dove down into this question from a Georgia perspective, but I think we need to state initially the capital and services are the two biggest issues that I deal with on a day-by-day problem. Having enough capital to build whatever the housing type looks like, or having basically the service providers and the service reach to people who need services, to get the DSPs, the proper service personnel in place and so forth. Georgia specifically has challenges because of the way the department's structure is and the lack of strategic vision. Now, every state has silos and state departments and agencies, but I'm working with other states outside of Georgia where there's collaboration between the different departments. There's actually joining of committees and personnel to work through IDD challenges in other states. Georgia they're changing quite a bit recently, but they have had the silo effect where that's not my problem, that's the other department's problem. In fact, in the past, it's been almost a finger pointing type of thing where, okay, I recognize that there's a problem, but the issue is basically this particular rule that is owned by this other department in the state, and they have to move first. If they move, then I'll change my policy. But that kind of bureaucratic structure is causing some of the problems we see today in Georgia. The second one is there's not a strategic vision or even a plan. One of the things you talked about with the light tech, that's the low housing income tax credit program in the state of Florida. When they rolled that out, what was it, 8 years ago? They applied it and they learned and they realized that the program that had created needed some tweaking. And every year since, they've tweaked it and they modified it and they supported it with other type of capital stacks or capital access to capital to support, because the cost of housing has had to increase over the last 8 years, significantly over the last couple of years. There's also challenges within the program as they move from state to, or city to city or location to location, where the cost of land, the cost of services, the cost of housing itself is dramatically different. This is in the state of Florida. So they have to change the rules. But you can't change rules like this. You can't pivot like this quickly if you don't even have a foundation of a program to build upon. And that's where, so Georgia's still at the very beginning of trying to create the foundations that is necessary.
Yeah, thank you, David, for that insight, and adding a little bit of context too around what Florida's done, because it is not as simply as easy as allocating part of your low-income housing tax credit to a specific population. There's a lot of considerations that they've layered on top of that. So I appreciate you adding that to the conversation. And I do want to be mindful of time because I want to make sure that folks get to ask you guys questions because there's a lot happening in the chat. But I do, David, you got a little bit of the issue of siloing among state agencies. And I want to ask each of you, how does this siloing, because this is an issue that we heard coming up and up and up again, how does it really impact the building of housing and community living situations for people with disabilities, and including IDD. So Desiree, I'll start with you this time. Can you talk about how this siloing impacts the ability to build inclusive housing? Kind of getting to that issue that you were talking about of an unseen population too.
Yeah, for a long time, it was the service provider that was relied upon to identify housing and make sure housing was going to be accessible for those that they were going to serve. And we are in a different world now where people with disabilities, including IDD, can choose a home and then access services within that home. And historically, Medicaid and services have created their one silo space, and then the housing and the evolution of affordable housing in all states have kind of gone this other silo. And when they don't talk to each other, we get left out of funding discussions. Every local community has to create a comprehensive plan, and oftentimes this population is not even mentioned in their comprehensive plan. So when the local planning department says that, well, maybe we have a parcel of land where we can get some money for land banking, they're not even thinking of this population because it's not on their radar. Local landlords might be hesitant to use housing vouchers if the tenant has an IDD. And technically, yes, that's supposed to be discrimination, but there's a lot of, workarounds from that. And so helping the housing industry be able to see and understand this population is absolutely critical, because it's not just about the housing, it's property management, it's landlords, it's being able to have housing in locations, in communities, and really having this population be part of a DEI effort. Local communities, developers, businesses, they have to look at diversity, equity, and inclusion. And we just don't see the IDD population as part of that discussion, and it needs to be.
Thanks. You provided a key informant interview for me, and or for the project, and just kind of opened, my eyes to that issue in a way that I hadn't realized before. And I really appreciate you bringing that perspective. And Pam, I want to move to you and kind of talk about the issue of siloing as folks navigate the benefits process. And you talked about it a little bit in the video, how hard it is to do, but what does that really look like for a family that's trying to transition, or not even transition, just navigate having a family member with IDD?
Well, if you think about it, there's Social Security, there's SSI, there's Medicaid, there's state services, there's Section 8 housing choice vouchers. You can go down one of the silos, hit a wall, and not even be able to move forward. And they don't talk to each other. Like Desiree just said, they don't talk to each other. We've been really fortunate here in the Seattle area to have one of the best disability housing choice voucher programs in the nation. And this program launched in the late 90s, and I was on the planning for that. And in the first 5 years of that program, we moved 450 people. What people don't know is, I hear always from families, well, our list never opens. It hasn't been open for 10 years. There's a 15-year wait. Well, here's the thing. If anybody can get on as many lists as they want across the nation. Typically, you have to live in that jurisdiction for the first year once you get a voucher. But if you're a person with disabilities, you can request reasonable accommodation to port. And we've helped families apply for Section 8 vouchers on open lists across the nation and port up to their own community. So there's ways to access that, and Section 8 housing vouchers give a lot of choice to people. They pay 30% of the income. They can rent from private market landlords. And yes, there are landlords who need to understand more about Section 8. And we've helped, I just recently worked with a landlord who said, I don't know, I don't want to do all the paperwork. And I said, I'll help you through it all. And, we got through the whole process. 3 roommates moved in to this beautiful unit. And he said, wow, thanks, Pam. That was so awesome. And I have 4 more units. And we just got a second group into another unit. So it's education. I think there's a lot of misunderstanding about Section 8 vouchers, and just so I'll leave it at that. Lots of navigation. And for parents who are trying to navigate those siloed social service systems, and also work to support their household, care for other children, provide care for their loved one. I mean, it's just a completely overwhelming process.
Yeah, thanks for that. Appreciate your perspective, especially, you're having worked in housing and housing supports for so long. It's really interesting. So I do want to talk a little bit about move to a solutions discussion or question, before we wrap up. And we will have a few minutes for Q&A. If folks have questions that they want to ask our panel, feel free to put them in the chat. But David, I'm going to ask you this last question, which is, what are some solutions to siloing that could improve access to housing for Georgians with disabilities, including IDD? You've talked about needing a strategy, but is there anything else that you kind of think of that could address this issue of siloing?
Well, siloing is, I think there's two camps. There's one, the advocacy groups, the general population, the people who are basically communicating what the needs, what the demand is, and what needs to be changed. And then there's the inside the departmental, state legislative walls and Capitol buildings and stuff. I like the proposal you have in your presentation materials and your report. There needs to be a more consistent kind of common voice in some ways on how that is structured to interface with state leaders. I've seen it so many times in the state of Georgia where these fractional teams of people have their kind of set opinions and ideals about housing, and they keep on banging that one drum without looking broadly across how every aspect of building housing and providing access to housing actually works, and stuff like that. So that's one thing I would look at. I think the state leadership today, underneath Kevin Tanner and other aspects, is there is an open-mindedness there, but we always have to kind of look at two factors in Georgia. One is there's an ongoing DOJ settlement agreement, and that agreement is still an anchor to some of the key policies that need to be kind of revisited and reworked on. So that's there. I don't know exactly how to, just wave a wand and get rid of it, but it's there. The second thing is people who work in the departments are executing the current policies and rules and regulations. They're not really the top people who are making policy changes. And I think they've been very much willing to jump into a lot of different conversations and to learn, but there is a hesitancy on them to basically approve something until it's actually built, done, operated, and looked at and surveyed and audited. And that's not only common in Georgia, that's common in many other states. But there is more, I think, willingness to kind of be part of that conversation in other states. Did that help answer, I guess?
And that gives, I think that's what gives us a lot of hope, is that we do have proof points around the country now that we can look at, and that has had variable financial stacks. And whether that's a rental product or a home ownership product, to be able to help families invest in housing stability for their loved ones so we can save some of those housing choice vouchers for those who really need it, is absolutely key. But we're slowly starting to. So David, I think it's wonderful that you think that everyone has an open mind and can come together, because there are proof points that we can look at. There are models that have been created across the country.
My team has done a study. There's actually 17 different states in the United States that have dedicated funding programs for IDD housing. There are 14 major cities also within the United States that have dedicated funding programs. And if you actually looked at a list and look at down actually how each one of these states is trying to do this, its creativity has created some of these funding programs, but there is a consistency. One of them is this housing trust fund type of thing. And the state officials here asked me specifically, what is that? They just looked at, okay, the majority of these state programs are this particular type of program. What is it? And there's a federal trust a housing trust thing that's in the billions and billions of dollars that is accessible. But anyway, and Florida actually does this on the capital planning for the low income and housing tax credits. But anyway, there's more conversation. My team is having conversations. There are 3 different funding programs that we're dissecting and looking at, and 2 of them are applicable in Georgia very quickly. But there's more conversation. Actually, there's more things that need to be done.
Now I'm the one that's muted. I'm glad that we got to end on a positive note and talk about some solutions. And I really, again, appreciate you guys for offering your perspective. And I know I saw one question pop up in the chat from Darcy about if there are if there's a robust residential assessment that is completed by the person with a disability rather than their family. But I see that Pam, you answered that yours can be completed by the family or the person.
Absolutely.
Can I have a follow-up to that? I'm sorry, I don't mean to jump in. Is the assessment written in a way that it's universally accessible? And also, what would happen if the person wants one thing and the family wants another?
You know, that's a good question. A lot of what we do is oftentimes someone will purchase our residential assessment and we'll give them several copies so that, you know, mom can do it, dad can do it, individual with disabilities can do it, and they can come, and then we come together, and it's a way to get toward a shared vision, because it really does take support to get there. But really, you know, it's a very person-centered process, and you know, we're all about the choice of the individuals. And, you know, we work with a lot of families whose individuals need more support to be able to do that. And they are, you know, we help them get to shared vision if there's a conflict. I don't know if that answered or if I missed part of it.
No, that's helpful. Zan put it better than I did in the chat. So is the language written in plain assessment with universal design for learning standards?
And I don't know about universal design for learning standards. We have had over 800 people complete our assessment, people who are speaking different languages, who have some support to complete the assessment. And most families find it most families and individuals, self-advocates that we work with, have been able to complete it on their own. So that's the best I can answer that.
Thank you.
And Darcy gets, you know, personal privilege to jump in and ask questions. And I also see not a question, but a comment in the chat from Amy saying that she's done this work with people moving from institutions to home. And when the ideas don't line up, there needs to be involvement from an advocate to support the person. And I think that really gets it, you know, just the issue of, you know, things don't always line up, and it's important to have support people, advocates, trusted partners for people with IDD, maybe even outside of the family. And that is an issue that came up too during our focus groups, is that sometimes that person is very difficult to find. And it looks like Zan has posted the plain language guidelines, which is a great reminder for all of us at all times to use those. But I don't see any more questions in the chat, and we are at 11:33. So I just want to take another opportunity to thank each of our panelists. I don't think I said this at the beginning, but Pam is on West Coast time, Desiree is on Mountain time. So they woke up early to be here with us, and just very much appreciate their perspectives. And, you know, David, also appreciate you being here, even if you didn't have to wake up super early. Really thoughtful discussion. As I mentioned, I look forward to continuing to engage with you all, learn more, move these policy recommendations or other policy recommendations forward, and really want to reiterate that This work will continue. We're really looking forward to that. I know that GCDD will continue advocating for housing and funding other groups to do that, that we will continue to work on these issues. And so please stay in touch. Please stay in touch with GHF to learn more about the projects. I've seen a lot of questions about recordings and slides. We will absolutely send out the recording to everyone that's registered, even if they weren't able to attend. We'll include the slides in that. We'll put it up on our website. And thank you all so much for your time today. Really appreciate everyone being here and for the great discussion. So hope everyone has a wonderful rest of their day. Have a wonderful Memorial Day. Enjoy, relax, and we will be in touch soon. Thanks, guys.